Now, helping you live healthy, a new study shows a decline in breast and cervical cancer screenings because of the pandemic. And we're talking about a big drop. So the number of tests decreased by 87% for breast cancer and 84% for cervical cancer in April of 2020 compared to the previous 5-year averages for that month in particular. Joining me now via Zoom is Dr. Rohit Rao. He's an oncologist at the Mayo Clinic Cancer Center. Good morning. Thanks for joining us.
Good morning. Thank you for having me this morning.
Doctor, would you explain the risks of delaying these kinds of screenings, beginning, for example, with breast cancer?
Sure. This was a very important study that was published just this week by the CDC's Breast and Cervical Cancer Early Detection Program. And the study looked at the impacts of the COVID-19 pandemic on the breast and cervical cancer screening rates in the United States. And as you mentioned, there was a big drop, as much as 87% for breast and 84% for cervical cancer at the peak of the pandemic. And these differences were even more pronounced for women of racial and ethnic minority groups and low income. Now, why this study is extremely important is for a number of reasons. Number one being that women of color often they do face a major burden of breast and cervical cancer in the United States, and delayed screening can lead to adverse outcomes. It can also increase the disparities in the morbidity and mortality of breast and cervical cancer in these patients. And this is something we are increasingly seeing. I'm seeing more and more patients coming to us, unfortunately, at a more advanced stage of their illness, essentially due to the delayed screening because of the effects of the pandemic.
And it's interesting too, doctor, because while with breast screenings, there may be some warning signs that a woman may notice in terms of lumps, et cetera, that would, increase her, her need as she knows and realizes to go to the doctor. The reality is with cervical cancer, sometimes there are no symptoms, which is why these kinds of screenings are so important.
Exactly. So for the breast cancer, some of the warning signs, symptoms that could potentially mean that this needs further evaluation would be like a new breast lump mass, changes in the color of the breast, nipple changes, nipple discharge. For cervical cancer, a lot of patients can be asymptomatic, but some of the warning signs could include abnormal excessive vaginal bleeding, vaginal discharge, pelvic pain, pressure, etc. So for both of these cancers, regardless of the symptoms, we always recommend your age-appropriate screening to be done in a timely manner.
And it is so important, as a reminder then to our viewers, women in particular, the need of making sure you contact your doctor and reschedule any of your annual exams that you might have canceled as a result of the pandemic. Doctor, thank you for your time this morning. We appreciate it.
Thank you for having me.